everyone, Dr. Holmes here, and welcome to another little brief segment of Pet Doc Sherlock, where we help people solve the mysteries of pets. So we've done a video on just general allergies and the symptoms to look for. We did a video on food trials, if you think your dog has a food allergy, and now we're going to do a video on environmental allergies and what we do about those. So again, environmental allergies tend to show up in dogs that are a little bit younger, but that's not always the case. They can show up at any point in their life, especially if you move from one place to another. I'm in North Carolina. The Southeast is the worst for environmental allergies. I worked with a vet from Pennsylvania who said she rarely saw dogs with allergies, just here and there. She moved down here, and we see dogs with allergy symptoms daily. We really do. So the Southeast is huge for environmental allergies, and I have a dog who's allergic to something outside. I think it's grass, and we just moved within North Carolina 2.5 hours. We were up in a place called Raleigh. We moved closer to Charlotte, and up there, he was fine. Down here, he has allergies from about April to October. So it can pop up at any point in their lives, but generally it's in dogs that are 1 to 3 years old. And with environmental allergies, you tend to see a seasonal component, unless it's to something like dust mites inside your house. Because, let's face it, you're not getting rid of those. Those are around. They're always going to be around. So, it's rare, but you can have a dog who's itchy all the time, even though it's environmental. But what are those environmental allergens? Let's kind of review those. I mentioned them in the other video, but usually it's pollen and grasses and trees and weeds, things along those lines. It's fleas. We talked about those in the first allergy video. It's dust mites, mold, and detergents or other things that could be in the environment. The question is, what do we do about them? My dog's itchy all the time. My dog is chewing its feet and keeping me awake at night all the time. And that tends to be what I see the most with environmental allergies, is foot licking or chewing and ear issues, recurrent ear infections, things along those lines. So how do we get relief for our dog? How do we figure out what's going on with her? Well, there's a couple of avenues of thought regarding environmental allergies. We can figure out what your dog is allergic to, and that tends to involve visiting with a dermatologist. There's some blood tests out there that are fairly accurate, but if your dog has severe allergies, they might want to do a skin test where they take various allergens that are in your area, specific species of trees and grasses and pollens, and it's much like with a person. They do little pricks on their skin and see which ones react the worst. The only time to really pursue that test, however, is if you're going to do immunotherapy injections with your dog, allergy shots. Now, we know in people, I'm sure you know people who have significant allergies, moderate allergies, and then mild allergies, depending on the time of the year. And not every person with allergies is going to go get allergy shots. So the same is true with dogs. But here's the deal. If your dog has significant allergies, they're terribly itchy, they're losing their fur all the time, you're dealing with skin infection after skin infection, then pursuing an allergy test followed by allergy shots, immunotherapy injections, will likely benefit you the most. Because with immunotherapy injections, you can get your dog to where they're not nearly as allergic as they were before, or even potentially cure their allergy. You make it so that their immune system doesn't respond to that allergen as much as it did before. It does take quite a bit of money up front. Usually the dermatology visit for a skin test or blood test is going to run you in the ballpark of $300-ish, give or take, depending on where you live. And then you have to pay for the allergy shots. Usually you start to give those at home, so if you're super needle averse or they freak you out, then that may not be a good avenue for you to take. But those injections cost a bit too, usually around the order of a couple $100 for the first 60 days, and then you start giving smaller amounts so that couple $100 starts to spread out and be over several months of time. The other trick with allergy shots are you have to give them 6 months before you decide if they're working. It takes a while for your dog's immune system to start to respond to those. So don't do them for a month or two. You've already spent the money for the skin test. You've already spent the money for the injections. Give it time. Be patient. They're likely gonna work for your dog. But if your dog doesn't have severe allergies, or you can't really do the whole injection thing, or you just can't fork up that much money up front for skin testing and injections, then there are other things we can do. There are 3 main treatments out there right now for atopic dermatitis, for atopy. One is called Apoquel, made by Zoetis, and it is a very small white pill that you give to your dog each day. Think about Claritin, Benadryl, things along those lines. It's similar to that, but for dogs. Now, let me just side note here. Claritin, Benadryl, Zyrtec, those type of things are not that effective in dogs. Some of them are safe at certain doses, but they're primarily antihistamines. And dogs and their itch mechanism, it uses histamines, but not to a great extent. So you might see a little bit of improvement with Benadryl or Claritin, but then over time you'll notice that it's not working nearly as well. And that's why we move to things like Apoquel. Apoquel works on the immune system itself. It works on the itch pathway and basically stops it from releasing the chemicals in the body that tell the body it's itchy. It does not immunosuppress them in any way. The other medication that's out there is called Atopic, made by Novartis. This one's been around a little while, and it is a little bit of an immunosuppressant, but it suppresses the part of the immune system that causes itch. And the dosing is a little bit different. It's not daily. You start daily, but then if your dog's responding well, you kind of find what we call the lowest effective dose. Some dogs might take it every other day. Some dogs might get to the point where they just take it a couple times a week and it works for them. The third product that we have at our disposal is called Cytopoint. That one is also made by Zoetis, and it's an injection that your veterinarian gives, and it again works on a little bit different mechanism than Apoquel, which is also made by Zoetis, but Cytopoint works on the itch pathway, and it tends to last anywhere from 4 weeks, so a month, to 8 weeks, 2 months. So your dog may need it once a month when it's having allergy symptoms, or it may need it every other month. It just depends on the dog. Now, all of these medications serve to make your dog comfortable. They prevent the skin infections because they reduce the reactivity of the skin itself. And they prevent your dog from scratching as much because your dog's not itchy anymore. Your dog's not going to be cured by taking these medications. It's just like in people. When you take Claritin, when you take Benadryl, you're just stopping the itch. You're not stopping your body from being allergic to something. And that's where the immunotherapy shots are a little bit of an advantage. They're working on the immune system to stop the allergy itself. These products are stopping the itch mechanism. And then those can be pricey depending on the weight and size of your dog. The last thing at our disposal that I use as a last-ditch effort are steroids. Steroids used to be all we had as veterinarians. However, steroids work great for itchy dogs, but they affect every single system in your dog's body. They will affect the liver, they will affect the kidneys, they will affect the heart, and if your dog is on them long enough, you'll start to see issues such as diabetes and weight gain and a host of other things. So I am fine using steroids on a dog that is severely itchy, and I'll do a short course at a lower dose. But for allergies and itchy dogs, I really try to avoid them if I can. I reach for those other medications that we have that are much safer than steroids. So hopefully this video has been helpful. Allergies are not simple. Environmental allergies are not simple. But the bullet points would pretty much be, if your dog has severe allergies, it's losing a lot of fur, it's dealing with skin infections all the time, it's time to think about allergy shots, immunotherapy injections, as long as you've already done a food trial and talked to your vet about food allergies, because those can be at play too. If your dog's mild, maybe moderate in the allergy department, you can't deal with needles, you don't want to have the upfront cost of a dermatology visit, then it's time to look into those other treatments such as Apoquel, Atopic, and Cytopoint, and your veterinarian will be able to tell you which is best for you and your dog's situation. And again, last ditch effort, please don't ask for the steroids right away. They do cause a lot of problems over time. Well, I hope that this has given you a lot of information about environmental allergies, how to kind of figure out what's going on, what to look for, and things to discuss with your veterinarian. If you like this video, please hit like. If you'd like to hear more information about dogs and cats, hit subscribe. And until next time, remember to keep your pets happy and healthy.